We have team coverage of the president's fight against COVID-19. Our David Schuman spoke to an emergency room physician about the president's move to the hospital.
And he has more on the experimental treatment. David?
Well, any conversation about President Trump's treatment and recovery has to consider that his age and weight put him in a higher risk category. It's why the emergency doctor I spoke to said moving him to a hospital out of an abundance of caution is a good move. The White House physician says President Donald Trump has been given an antibody cocktail, a medicine not available to the public that the company says has helped improve symptoms in trials of non-hospitalized patients.
Moving him to the hospital may be to prevent any adverse side effects from that cocktail of antibodies or the other medications he's receiving from being a problem outside of a hospital environment, or maybe in anticipation of him potentially getting significantly worse.
Trump's doctor says the president is also taking zinc, vitamin D, heartburn medication, melatonin, and a daily aspirin. Dr. John Hick with Hennepin Healthcare says the risk of severe COVID disease for anyone the president's age is high. At the recommendation of doctors, Trump will be working out of Walter Reed Medical Center the next few days, a federal hospital in Washington, D.C.
They have a special area just for the president that is reserved for his or her use at any time and is capable of providing any critical care services that the president might need.
With such a wide range of possible outcomes for COVID, it's hard for even the doctors familiar with the disease to put a time frame on Trump's recovery.
At age 74, even a mild influenza-like illness could require quite a bit of recovery time, and that's assuming that things don't get worse. Hopefully the antibodies will do their job and prevent the severe complications of COVID that we've seen in many, many different age ranges, but particularly in the older patient population.
The White House press secretary said in a statement, President Trump is in good spirits, has mild symptoms, and worked throughout the day. President Trump, of course, had events here in Minnesota before testing positive. The doctor I talked to said if you were at one of them, it's too early to get tested. He recommended waiting a week or so.
All right. Thank you, David. And as David just mentioned, the president was in Minnesota just before testing positive. Between a private fundraiser in Shorewood and a rally in Duluth, he came in contact with several local Republicans, and they have been getting tested to see if they also have the virus. Today, Congressmen Tom Emmer, Jim Hagedorn, and Pete Stauber all announced that they have tested negative.